So nurses know what a float pool nurse, and we may use float pool and staffing resource or SRO interchangeably in this episode, but we know what SRO nurses do because it's the same job expectation as floor nurses, but not many people know or understand what being in the SRO is actually like or how it might differ from floor nursing. So can you explain just some of the background details of being in the SRO?
So for clarification, SRO stands for Staffing Resource Office. So pretty much it's a resource of nurses from a variety of backgrounds. You have acute care nurses like myself, you have ICU nurses, you even have ancillary staff like companions, patient care associates, or they call them CNAs now, so pretty much, our role is to help staff and support other units, including the emergency department. So I'm specifically an acute care nurse, so I get to flow to acute care units.
Yeah. And how do you normally get your daily assignment? Because normally in floor nurses, they will just come to the unit, but it's a little different with SRO.
Absolutely. It's different from SRO. So my understanding is that with SRO, there's different levels of staffing. We have travel nurses. We have people who are full-time with SRO. I personally am part-time, or what's called wage. So we utilize the resource Chronos. We go in there, we create our own schedule as long as we meet the minimum requirements. So we go by schedule periods, and these schedule periods are 6 weeks. And so the minimum requirement is as long as you work 72 hours. Obviously, with COVID, those requirements increased. They used to be 36. They doubled it because of the increase in staffing needs and demands.
Oh, I didn't know that.
Yeah. So
even for part-time?
Even for wage, yes. We are all required now to do 72 hours in that 6-week period. And that includes 2 weekends. And then we also have to fill in for holidays, both minor and major holidays. So we just go into Chronos, put in our schedule. Me being a nurse educator right now, full time, I just work Saturdays right now. It works for me because that way I'm able to meet my requirements, and I'm able to meet the weekend requirements as well.
Sure. Yeah. Gosh, that's got to be so tough, because I was just thinking about that. Because I mean, when you're part-time because you have the second job, and now you have to have this minimum 72 hours it's
a lot.
2 weeks. It's 2 weeks essentially, or 4.
So it depends on how you do it. Like for me, I work every Saturday right now, so mine is stretched the whole 6 weeks. But someone else.
I see. Okay.
I mean, and I've done this when I have time off from PVCC. I worked 3 shifts back to back, and I was able to have a couple of weeks off here and there. I even at some point had a 6-week vacation stretch of time. So yeah, as long as you meet the requirements in that 6-week window.
Sure.
How you do it is up to you.
Is up to you.
Yep.
Okay.
Yep.
What is the chain of command like? Like, how often do you see managers? Like, do you guys have meetings or anything? Or is it pretty, like just individual based?
Absolutely, Maggie. Good question. So right now with SRO, I believe we have about 3 to 4 managers, and each manager covers a certain group of staff. So for me, being an acute care SRO nurse, I have a manager that manages us. We have another manager that manages the critical care nurses. And then we have another manager that covers ancillary staff, health unit coordinators or HOCs, the patient care companions, and the CNAs.